Essential Guide to Pediatric Immunization Schedules. Introduction to Immunizations. Welcome to this video, where we focus on immunization schedules. What are immunizations? Immunizations protect children from preventable infectious diseases. Vaccines work by stimulating the immune system to develop long-term immunity. Types of immunity. Active immunity comes from vaccines or natural infection. It provides long-lasting protection. Passive immunity is temporary. It comes from maternal antibodies or immunoglobulin therapy. Why immunizations matter? They save lives. They prevent outbreaks. They protect vulnerable populations. They're one of the most cost-effective health interventions. Types of vaccines. Different vaccines work in different ways. Live attenuated vaccines. Examples include MMR, varicella, and rotavirus. They produce a stronger immune response. They're not recommended for immunocompromised children. Inactivated vaccines. Examples include hepatitis A, polio, IPV, and influenza. They produce a weaker response and require boosters. They're safer for immunocompromised individuals. Toxoid vaccines. Examples include diphtheria and tetanus. They protect against bacterial toxins. Subunit and conjugate vaccines. Examples include HPV, pneumococcal, and meningococcal. They contain specific parts of the pathogen. The immunization schedule. Following the schedule ensures optimal protection. Key points. Immunizations start at birth and continue through adolescence. The schedule is set by CDC, AAP, and WHO. Timing is based on when immunity is most needed. Catch-up schedules exist for children who are behind. Schedule development. Based on extensive research. Considers disease risk by age. Accounts for immune system development. Balances effectiveness with safety. Birth to 6 months schedule. The first months establish foundation immunity. At birth. Hepatitis B vaccine, first dose. At 2 months. DTaP protects against diphtheria, tetanus, and pertussis. IPV, inactivated polio vaccine. HIB protects against Haemophilus influenza type B. PCV, pneumococcal conjugate vaccine. Rotavirus prevents severe diarrhea. Hepatitis B, second dose. At 4 months. DTaP, IPV, HIB, PCV, and rotavirus all repeated. At 6 months. DTaP, IPV, HIB, PCV, and rotavirus completed. Hepatitis B, third dose. Influenza vaccine begins annual vaccination. 12 months to 4 years schedule. This period includes important combination vaccines. At 12 to 15 months. MMR protects against measles, mumps, and rubella. Varicella prevents chickenpox. HIB booster dose. PCV booster dose. Hepatitis A first dose. At 18 months. Hepatitis A second dose completes the series. At 4 to 6 years. DTaP booster before school entry. IPV booster dose. MMR second dose. Varicella second dose. School entry requirements. Most states require these vaccines before kindergarten. Ensures protection in group settings. Adolescent immunization schedule. Adolescents need boosters and new vaccines. At 11 to 12 years. TAP, tetanus, diphtheria, and pertussis booster. HPV human papillomavirus vaccine, 2 doses if under 15 years old. Meningococcal vaccine protects against meningitis. At 16 to 18 years. Meningococcal booster dose. This provides continued protection through college years. Additional considerations. Annual influenza vaccine continues. COVID-19 vaccines as recommended. Catch-up vaccines if behind schedule. Catch-up immunization schedules. Not all children receive vaccines on time. When catch-up schedules are used. for children who are behind on vaccines. After missed appointments. For newly immigrated children. Following medical exemptions that have resolved. Key principles. Guidelines exist to minimize unnecessary doses. Minimum intervals between doses must be followed. Example, DTaP catch-up doses are given at least 4 weeks apart. Resources available. CDC catch-up scheduler tools. State immunization registries. Provider decision support systems. Contraindications and precautions. We must know when not to give vaccines. Permanent contraindications. Severe allergic reaction or anaphylaxis to a previous dose. Anaphylaxis to vaccine components. Encephalopathy within 7 days of pertussis-containing vaccine. Temporary precautions. Moderate to severe acute illness. Wait until the child recovers. Pregnancy for live vaccines only. Recent receipt of antibody-containing blood products. Important note. Minor illness with low-grade fever is not a contraindication. Don't delay vaccines unnecessarily. Common vaccine side effects. Most side effects are mild and expected. Mild reactions. Redness or swelling at the injection site. Low-grade fever. Irritability or fussiness. These typically resolve within 1 to 2 days. Moderate reactions. Febrile seizures are rare, mainly with MMR. High fever over 104 degrees Fahrenheit. These require monitoring but usually resolve without complications. Severe reactions, very rare. Anaphylaxis occurs in about 1 in 1 million doses. Guillain-Barré syndrome has been associated with flu vaccine in rare cases. Parent education. Explain expected reactions. Provide comfort measures. Teach when to seek medical attention. Vaccine administration guidelines. Proper technique ensures effectiveness and safety. Route selection. Intramuscular IM vaccines include DTaP, HIV, hepatitis B, PCV, and HPV. Subcutaneous SQ vaccines include MMR and varicella. Proper needle length. Newborns, 5/8-inch needle. Infants 1 to 12 months, 1-inch needle. Toddlers 1 to 3 years, 1 to 1.25-inch needle. Injection sites. Anterolateral thigh for infants. Deltoid muscle for older children and adolescents. Best practices. Never aspirate before injection. Use proper angle for route. Apply gentle pressure after injection. Document immediately. Special considerations. Some children require modified schedules. Immunocompromised children. Avoid all live vaccines in children with HIV/AIDS, cancer, or on chemotherapy. Avoid in organ transplant recipients. Inactivated vaccines are safe but may have weaker response. Premature infants. Follow chronological age, not corrected age. Use full vaccine doses. May need additional RSV prophylaxis. Children with chronic conditions may need additional vaccines like pneumococcal. Influenza vaccine is especially important. Coordinate with specialists. Vaccine storage and handling. Proper storage ensures vaccine effectiveness. Temperature requirements. Refrigerated vaccines at 2 to 8 degrees Celsius include DTaP, hepatitis B, and HIV. Frozen vaccines at -15 degrees Celsius or lower include MMR and varicella. Critical rules. Never refreeze thawed vaccines. Discard vaccines exposed to incorrect temperatures. Document storage temperatures daily. Have backup power for refrigerators. Quality control. Designate a vaccine coordinator. Use calibrated thermometers. Monitor temperatures continuously. Have emergency protocols. Legal and ethical considerations. Vaccination involves legal requirements and ethical responsibilities. Informed consent. Parents must receive a vaccine information statement, VIS, before administration. VIS explains benefits and risks. Document that VIS was provided. State mandates. Most states require vaccines for school entry. Some states allow medical exemptions. Some allow religious or philosophical exemptions. Requirements vary by state. Ethical responsibilities. Respect parental autonomy. Provide accurate information. Advocate for child's health. Address concerns compassionately. Addressing vaccine hesitancy. Some parents have concerns about vaccines. Common concerns. Fear of autism, this has been thoroughly debunked by research. Concerns about vaccine ingredients. Worry about long-term effects. Too many vaccines too soon. Effective communication strategies. Listen without judgment. Provide accurate, evidence-based information. Address fears with empathy and facts. Share personal experiences when appropriate. Acknowledge uncertainty while emphasizing known benefits. Encourage shared decision-making. Offer reliable resources for further reading. Building trust. Establish rapport over time. Respect cultural beliefs. Provide consistent messages. Follow up on concerns. COVID-19 vaccines for children. COVID-19 vaccines are now part of pediatric care. Current recommendations. COVID-19 vaccines are approved for children 6 months and older. Pfizer and Moderna vaccines are available. Dosing depends on age group. Benefits of vaccination. Reduces severe illness and hospitalization. Decreases long COVID risk. Protects vulnerable family members. Allows safer return to normal activities. Addressing parental concerns. Provide clear guidance on benefits. Explain safety monitoring systems. Discuss side effects honestly. Acknowledge that vaccines are newer but extensively studied. Nursing responsibilities. Nurses play a crucial role in immunization programs. Pre-administration. Screen for contraindications and precautions. Review immunization history. Ensure vaccines are properly stored. During administration. Use correct technique and site. Provide age-appropriate preparation. Comfort the child during injection. Post-administration. Observe for immediate reactions. Educate parents about expected side effects. Provide written aftercare instructions. Documentation must include vaccine name and manufacturer, lot number and expiration date, administration site and route, date and time given, your signature and credentials, VIS publication date. Let's review the essentials of immunization. Key takeaways. Vaccination is the most effective way to prevent infectious diseases. Following age-appropriate immunization schedules ensures optimal protection. Understanding contraindications prevents adverse reactions. Proper administration techniques ensure vaccine effectiveness. Documentation is both a legal and clinical requirement. Nurses play a vital role in educating families and increasing vaccine confidence. Addressing vaccine hesitancy requires empathy and evidence-based communication. Staying current with recommendations ensures best practice. Thank you for watching. Your role in promoting immunization is essential to protecting children and communities.